Hey everybody, I hope you're having a great Wednesday and ready for the snow like we are here. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about when you can't turn your head. So I was having a hard time labeling this and titling this because I don't exactly know what you call it, but it's happened to me. We get patients in here all the time with it. It's that when you wake up in the morning and you go like this and pain shoots down your side of your arm, you can't turn your neck any further. You know, the pain may actually just stay in your neck, but it's a severe pain where you just can't turn your head anymore. It's never happened before, maybe it's happened once before, but you wake up and there's a kink in your neck or there's some pain in your neck. Sometimes it can be pain all the way into your hand, but what we most often see or most often hear is, I just can't turn my head. So when you're driving, you're turning your body to do this. When you're trying to turn anywhere, instead of being able to turn your neck, you're turning your body. So there are two instances of this. This can be a long-term issue and this can also be a short-term issue. So I'm going to talk more to the short-term implications. This is when you just wake up with it that day. Maybe you slept weird, maybe you slept in the wrong bed. What you do immediately to help that out. And in the process, we'll get into some of that long-term solutions. But if this has been going on for months where you've had to adjust and you find yourself really turning your body instead of turning your head, you need to make sure that you are definitely getting that treated. That's going to lead to some severe long-term issues that you want to avoid if possible. But what happens when you can't turn your head? So most of us, we'll just say, okay, we don't turn our head. We're not going to move our head. Unfortunately, a lot of times that's going to lead to a lot of compensation issues. That's going to lead to a lot of problems down the line, and it doesn't always go away. So that one little pain that happened and you woke up and you couldn't turn your head has snowballed now and has been going on a week, a month, and you're really getting some electricity in there. You're really just getting some severe pain to the point where you just can't turn your head. So what do you do? So I always say some of the biggest, what's the word I'm looking for? I don't know, it's very late. So what is going to determine the outcome is a lot of times what you do right away. And a lot of times people right away just don't do anything. Or they'll take some Advil, or they'll just stop doing any movement. And that, unfortunately, is kind of the wrong thing to do a lot of times, because especially when you wake up with that pain and you don't know how you got it, taking that Advil or putting that ice on it on a sprained ankle, 100% the way to go. You know, you don't want to push something that you've fallen on or some traumatic injury. But when you have a pain where you wake up and you're like, oh my gosh, I can't turn my head, and you don't know where it came from, that's not the instance where you want to stop moving it. That's the instance where you want to pop Advil and just pray it goes away. There are specific steps that you want to take to eliminate that pain. So the first thing that you want to do is you actually want to get into a nice hot shower. And the main thing you want to do with that hot shower is start to move. So you don't want to just stand there and do nothing. When you're doing any sort of movement with your neck and you're dealing with a painful head turn and you can't turn your head or you can't bend or whatever it may be, some sort of neck movement is aggravating you, you want to make sure that your shoulders are first relaxed. The very first thing people like to do when their neck is in pain is to tense their shoulders, is to shrug their shoulders. That's going to help them guard their neck, and that's going to lead to a lot of problems. And while you may be able to get more range of motion as you turn your head, you're not going to be able to sustain that, and you're going to wind up injuring yourself further. So this will feel really good at first. It will allow you to get more range of motion, especially if you're lacking that side mobility. It'll allow you to touch your ear, but it will overall result in some long-term problems that you're going to have to take some time to reverse. So don't get into this habit. Don't start shrugging. And it's a very easy habit. You're not going to realize you're doing it because you're in pain. And the only thing you're thinking of is get out of pain. And the neck just wants to do this and elevate the shoulders and keep you as pain-free as possible. That's not the case. So what you want to do is you want to make sure that your shoulders are relaxed. And all throughout the day, as you're dealing with this, you want to take a nice deep breath in and relax your shoulders. It's important that you do that. So now you're standing under that hot shower. What you want to do is you want to start with gentle range of motion. So I don't care if this is all the further you can move your head. All right, this is where you start. It has to be very minimal. You want to move within a pain-free zone or an uncomfortable zone. So you don't want to go all the way to the end and start jamming it to where you've got sparks running down your arms or it's extremely painful. You want to keep it just in a pain-free zone. And if this is all it is, then this is all it is. And you want to spend the time just going back and forth. Whatever the movement is that you're having problems with, start with that movement. And you want to start in the direction that doesn't hurt. If they both hurt, then it doesn't matter which direction you start in. But if you're able to look to your left and not have any pain, that's where you want to start. And then you want to slowly rotate to your right and then go as far as you can where you don't feel pain. And then you go back to your left. This is not a quick exercise, nor is there a prescription for how many times you do it. You want to try and get a little bit further each time going to the right. But what you don't want to do is you don't want to jam it over there. So you don't want to take your arm, you don't want to jam it, you don't want to force it, you don't want to push past where it feels comfortable. You just want a nice gentle rotation to the left and then to the right as far as you can go. You're going to repeat this for about 5 minutes until you can't tolerate it anymore or you feel like you've gotten some range of motion. All right. The next thing you're going to do is you're going to take the second range of motion. So it doesn't matter. I always say start with the one that hurts the most. So if this is where it hurts you, start with that one. Okay. And then if this one is not as painful, all right, then go into side bending. Same thing again. You're going to just nice and easy start with the side that doesn't hurt and then go to the side that hurts. And then each time you go over, you want to try and get a little bit further. It may get tired after a while, but again, don't jam it into painful range of motion. You shouldn't feel a lot of pain when you're doing this. This is just movement to get that joint opening up, to get those muscles opening up. And again, you don't want to be like this. You don't want to be doing anything that looks like this. And finally, what you want to do is then you're going to go up and back. All right, nice and slow. Again, wherever it feels better, you go there first and then a little bit back or wherever. But those are the 3 range of motions that you want to start out doing right away in the shower, nice and slow, again, within a pain-free range of motion, trying to get a little bit more each time. Then you want to do some neck circles. So your neck circles may be here at first. Okay, nothing too great, very minor neck circles. That's okay, that's where you start. Not crazy, not big, not fast. All right, so nice and slow in a pain-free range of motion, as far or as little as you need to go. Make sure that you are getting every spot as you rotate around. You want to do clockwise and you want to do counterclockwise. Again, there's no real prescription for this. When you're in a lot of pain and you're in a lot of neck pain especially, you want to spend the time underneath that warm shower doing a lot of range of motion exercises, loosening up that neck so that way you're able to go through your day and function. So take as much time as you need. These are not exercises where you're going to do 10 repetitions and it's going to be done. These are going to take 15, 20 minutes and you may only move like an inch further. But allowing that joint to open up is going to be exactly what you need to do. So then you're out of the shower. So we've done all of our counterclockwise circles, clockwise circles. We're feeling a little bit looser. What you want to do for the rest of the day is not sit or stand for too long. So you want to set a timer for every 15 minutes to be getting up or down from a chair. You also don't want to be on your phone. This posture is going to aggravate it. I don't care if this actually feels good and you're like, no, that feels good. She doesn't know what she's talking about. This is going to make everything worse. All right, so stay off your phone. If you do have to use it, you're up here and you're using it. Again, your shoulders are relaxed and you are changing position every 15 minutes. Why? You're going to keep the blood flowing to the neck. While you're doing this throughout the day, you want to incorporate those gentle range of motion exercises. You want to incorporate those circles as often as you can because it's going to help loosen that joint up. It's not something that you do in the morning where you hop in the shower and then 20 minutes later you're like, I'm done, it's healed. It's not going to work like that. You're going to do it continuously throughout the day as you move from position to position. This can take care of that neck pain within a day or two where you don't feel it anymore. So it's really important that you kind of take to the time, and while it may be a pain in the butt at the time, it's better than spending months and months in therapy because you jammed your neck or you learned a compensation pattern where you're shrugging your shoulders like this. Numbness and tingling, that is persistent. Like you can't get rid of it and it is just shooting down your arm. You need to go see somebody, okay? Don't mess with that. That's a nerve. If you turn your head and you feel a shock going down your arm, that's differently. If you wake up and there's numbness and tingling in your arm and it's not going away, you want to make sure that you get that addressed immediately. So I'm just talking about pain that's kind of right there in that neck. If you or someone you know is suffering with neck pain and wants a free consultation with a doctor of physical therapy, all you can do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.